Well, good evening, everybody. I know it's kind of difficult to come out here on a Tuesday in the evening, and the traffic was horrendous. So anybody who has any questions, we're open to them during the course of this. We're going to make it very simple to understand the growing epidemic of concussion. And I would like to extend a thank you to the Miami Dolphins. So to get this started, we're going to get this moving quite fast, and I would like to bring up probably two of my favorite people in the training room, and I'm not just saying that because they would squash me once they get up here, but Mike Pouncey is our center. Mike, come on up.
Thank you, brother. Hi. I'm Mike Pouncey, and I'd like to welcome everyone to the Athletic Tips Community Workshop. I'd like to also thank Athletic Tips organization for conducting these free educational programs throughout the community. I would also like to thank the Miami Dolphins for helping us arrange this important program and recognition and prevention of concussions. As a professional athlete, I know the dangers and problems that come from head and neck injuries. That's why it's so important for parents, coaches, teachers, and athletic trainers who are working with young athletes to have this information. You're the most important people in their lives of student athletes, and the keys to helping them pay for a safer game. I'd like to thank you guys for having me this evening, and I'd like to introduce my teammate, John Jerry.
Thanks, Mike. Hello, everybody. I think you know of my reputation as an aggressive, hard-hitting football player. Tonight, I am here to tell you how important it is to learn about protecting young athletes from physical injury. I have been lucky in my career and made it to the pros. Along the way, I have given a lot of hits. I've taken a lot of hits. It's all part of the game of football. The important thing is to get in shape, stay in shape, and be prepared to take those hits. Now, I want to do what I can to help the young kids of America to succeed without suffering serious injuries. The presentation you are about to hear will provide you with the important information. Now I'd like to introduce the shortest chiropractor in America, Dr. Spence Barron.
You probably wonder why I have such good calf muscles, because I always have to stand on my toes for these guys. Yes, I am Dr. Spencer Barron. I am the chiropractor to the Miami Dolphins, and it has been an extraordinary experience. I've been with them since Coach Shula, so we're talking about 18 years, and the quality of player is always, the more involved I get, the more fascinating it is. And to understand how their minds work is extraordinary as well. So let's move on and talk about the mind. But first, I'm going to introduce my very close buddy, Dr. Alan Sokoloff. Don't hold it against him. He is the chiropractor to the Ravens.
The theme of today is kind of going to be what you see on the screen there, that when in doubt, hold them out. Every day there's more and more information about concussion that's coming out. Every league, every community, every state has different laws as to how we as parents or we as coaches have to handle concussion. But the theme is going to be, when in doubt, hold them out, because we want to always err on the side of safety. So let's go through a couple of things. This is one of my favorite quotes, that concussion is not new. And if you look through this, it's talking about during the last 7 years, there's been too prevalent, allowing players to continue with concussion and how they should be avoiding activity after concussion. Do you know when this was said? 1937. So everybody thinks that, oh, well, concussion's new. We really have to start doing something. No, we don't. This has been going on forever. But now that it's becoming even more prevalent, now that it's being brought more to our attention, now that we're seeing the physical effects and the long-term effects of concussion, it's time to start to do something about it. So we're going to talk about concussion awareness. Now, there are every day when you pick up a journal, every day when you pick up a magazine, every day when you pick up anything to read, on the cover someplace, there is more and more information about concussion. And it's not just in football, it is in many sports. So our job is to help present all this information that's out there from different types of journals and break it down for you. And again, we're not just talking about youth sports, but what about a kid that rides a bike? What about all the different sports that are out there? There is potential for concussion in all these sports. So what we're going to try and do over the next few minutes is help educate you how to prevent concussion. And what if concussion happens? What should you as parents, what should you as coaches do? What is your responsibility to help that child? And to do that, I'm going to introduce Dr. Jay Greenstein. And
it's good to be here. It's good to be here. So first, I want to talk about really what is a concussion. So in 2012, a group of scientists and medical professionals got together in Zurich, Switzerland, and this is actually their 4th annual conference, and they really got together and created consensus around what concussion was and how concussion was going to be managed in sport. And here was their very, very fancy and technical definition of concussion: a complex pathophysiological process affecting the brain induced by traumatic biomechanical forces. That's some pretty complex stuff, right? So let's break it down for you and me. What does it mean to the person who's out there on the field? What does it mean to the parent, the teacher, the coach? So it's a type of mild traumatic brain injury. It usually occurs as a result of a bump or blow or jolt to the head, but can also occur when there's a blow or a fall to the body. And this is a really important point to understand, because if an athlete is on the field and there's forces that are imparted, they take a big hit, they fall hard, and there's no impact seen to the head, that doesn't mean they don't or couldn't possibly have a concussion. So it's actually the acceleration or the forces that get created, the front to back, the rotational forces that get created when these impacts occur, that determine whether or not somebody actually has a concussion. At the end of the day, due to these forces imparted on the brain, there's actually a chemical change in the brain. And so all concussions are serious, so we have to take them very seriously as athletes, as parents, as coaches, but most people do end up recovering fully and relatively quickly. Now, they can occur with or without a loss of consciousness, and they can occur in any sport, as Dr. Sokoloff was just describing. So how often does this happen? So if you had to guess what are the most common sports where people were experiencing concussion, it's not a surprise that football is one of them. So this was a study that was published in 2012. They looked at 20 different sports in high school athletics across the country. And what they found is that by far, football had the most common incidence of these types of injuries, 47%. But interestingly enough, women's soccer and women's basketball actually make up 14% of total concussions. So we have to consider the female athlete as well. Now, in this study, they also looked at when these injuries happen. Do they happen just during games, or do they also happen in practice? And believe it or not, 33%, 1/3 of the concussions actually happen in practice. So we have to be aware and create programs and have strategies, not just for game day, but also what's happening during practice as well. There was another study that was done in 2012, and they looked at the types of concussions that were occurring, and 87% were new. But the concern that we have as providers, as parents, as teachers, as coaches, as athletes, is that 13% are actually recurrent. In other words, they've had repeat concussions. Why is that a problem? Well, they become a much higher risk in terms of pathology. So if you have 3 or more concussions, it means that you're 3 times more likely to sustain additional concussions down the road. 3 or more means you're 3 times more likely. So this is a very, very serious problem, and we want to make sure we reduce the risk of these recurrent injuries. Slower recovery is associated with multiple concussions, and if you've got a younger athlete, it's typically going to take them a longer time to recover. The U.S. Department of Health and Human Services also looked at a tremendous amount of data. They published that data in 2011, and what they found is that children equaled 90% of hospital ER visits for sports-related concussions. So what does that mean? 10% were adults, 90% were kids. So children treated for concussions commonly had other injuries, right? They had other impact injuries, maybe sprains, strains due to these impacts, but again, they also had concussions as well. And about 12% experienced a moderate or prolonged loss of consciousness, and 21% of our kids actually experienced a brief loss of consciousness. That's a big issue. Now, if we look at the global data over the last 9 years, from 2001 to 2009, the incidence, the rate of injuries of these types of concussions have increased 60%. So 60% increase over an 8-year period of ER visits for kids under 20. Now, is this due to the fact that it's more dangerous to play these sports? Or is this due to the fact that the kids are getting bigger and faster and stronger? Or is this due to the fact that we're getting better at actually identifying these types of injuries? At this point, we don't know. But we do know it's on the rise and we need to do something about it, and that's why we're here today. I mean, what do you think you're going to see from these young athletes? I mean, they're going to present with some pretty significant symptoms, right? So dazed, stunned. If they move clumsily, that's a warning sign. If you ask them questions, what's your name, what's today's date, where are you, and they can't answer very quickly, that obviously is a problem and is going to give you an indication that the athlete has suffered a concussion. If they forget their plays, so you're not really sure, maybe they had a blow or you didn't see anything happen to them, they go out on the field, they forget their play. Or they can't follow directions about their assignment or know where they're supposed to be lining up. Those are all signs and symptoms that you're going to see on the field with these athletes that may indicate this kid has suffered a concussion. Any behavioral or personality changes, again, a warning sign. And if they can't recall the events before or after you're having that conversation with them, again, a big warning sign. Now, what they might report to you. So before is what you're going to see, right? The previous slide is what you might see with them, an observation. This is what they may report to you. A headache or head pressure. Nausea or vomiting, again, a big warning signal. This is probably the most significant one. So if the athlete has some significant balance problems and dizziness issues, he's reporting dizziness, he's staggering, he's unbalanced, uneasy, that's a big problem and typically indicates a much greater severity of injury. If they've got double vision or blurred vision, again, that's a serious warning sign. Sensitivity to noise or light, again, a warning sign. Confused, foggy, sluggish. And if he says, you know what, coach, I don't feel normal. I don't feel right. All very, very important warning signs that your athlete will report to you. Now, these are red flags. These are the times when you have to pick up the cell phone and call 911. No ifs, ands, or buts. You pick up the phone, you call 911. So any sign or symptom that I just reported that actually starts to progress, that gets worse. If one pupil, which is the dark part of the eye, if that part of the eye is bigger on one eye than the other, again, big warning sign, call 911. Inability to wake up, again, an important warning sign, call 911. Weakness, numbness, or decreased coordination, again, almost tied to that balance issue, that coordination issue, and loss of consciousness, all significant red flags. Again, if you observe vomiting and nausea, especially if it's getting worse or not stopping, big warning signs, slurred speech, seizures, convulsions, also very, very important. Inability to recognize where they are or who their coach is. Increased confusion that progresses. And unusual behavior. It's time to pick up the phone and call 911. And, we talked about when in doubt, leave them out. But also, it's all about player safety and making sure these kids don't have recurrent injuries. If there's any doubt in your mind, call 911. Just call 911 and get them there so the player is safe. So next up, Dr. Spencer Barron is going to talk about concussion management.
Thanks. This is obviously my favorite part because it's something that you could actually do after the action happens. So let's talk about what you do if you suspect a concussion. The bottom line, and you'll keep hearing this over and over again, remove the player, obviously. After you remove the player, advise the parents what they should do, suggest the athlete to be immediately evaluated by an appropriate, keyword is appropriate, healthcare professional, because not every healthcare professional understands the dynamics today. Because years ago, they thought they did, but now it's become a lot more sophisticated. Document everything that you observe as a coach and a parent, and then we'll get into the teachers and other things, other people that should be involved in this process too. And you'll keep hearing the theme. When in doubt, hold them out. Be sure to inform the doctor of these particulars. What was the mechanism of injury? Where to the head? Was it helmet to helmet? Was it stick to head? Was it elbow to head, knee? There's several different entities that can occur. Was there any loss of consciousness? Most importantly, you don't have to knock out and black out to be considered a concussion. That was yesterday's conversation. Today, it goes into much more of a dynamic situation. Any memory loss immediately after or following the incident, and number of previous concussions, if any, and how recently. Don't wait for this to happen before you determine that there's a concussion. All right, here's another one. Same day return to play. Never, simple, never do that. Like yourself, there's no way you can play that same day. Treatment and recovery, the majority of concussions, 80 to 90% of them resolve in a short term, 7 to 10 days. Recovery time frame may be longer in children and or adolescents, of course, because their brains are still developing. Now, here is the management in the first 24 hours. So important. Now, if the child is hungry, obviously, in those first 24 hours, and everything after the 24 hours, start feeding them very small meals consisting of protein and low carbs. The key here is think of it like a trauma to the thigh, like a contusion to the thigh. You want to treat the brain the same way. It's even more sensitive. Reduce inflammation and swelling. Here's what you do. Let's just talk in terms of, in plain English, physical activities. Cognitive is monitor what they're doing to process thought. And I'll get into that in a little more detail in a moment. Consider their concussion history. Was there past concussions? How many? How long ago? So on. Be individualized to the athlete, because there is no one concussion in an individual that's the same. It's like a fingerprint. Don't. Obviously, again, I'm hitting that message again. Return to play the same day. Do not. Monitoring the concussion again. Refer to a specialist in these situations. If the symptoms have not gone away in 7 to 14 or 10 to 14 days. Symptoms, obviously, if they get worse, or the patient has had a history of concussion, which we call second impact syndrome. That means they get hit lightly, they don't knock out or anything like that. But my goodness, the most important thing to be careful of is if they hit their head again, because it's cumulative. Return to activity and school. And believe it or not, the activities that go on in school are much more critical than whatever goes on at home. So here's what we do. Returning to school, plan the needs to be individualized for each patient. Manage the exertion that the mind is going to go through. So these are the ways to review what they are going to go through during the course of the day. Computer, television, cell phone, reading. The text messaging it's a lot of thought process. It's not as simple as you think that goes on in the brain. Now, here's an important thing. Because the nurses and the teachers and whoever else that is a part of your son's life at school has to be part of that program to monitor their concussion. They need to be privy to all that went on so they can identify, because they're going to be with your kid for 8 hours that day. Here's all the host of things that they need to be aware of. And I'll read them out loud to you because I see note-taking going on, so I want to make sure you get that down. So problems concentrating, remembering new information, longer time required to complete tasks, increased symptoms, headache and fatigue, and greater irritability or poor academic performance. Returning to school. So these are the areas that they can control. Time off, shortened day, shortened classes, rest breaks, allowance for extended time to complete coursework, reduce workload, untimed tests. Those are all areas you can modulate in school to make sure that they don't overload the child. Okay. Now, how are we going to get the kid to get back into action? Returning to play, you got to first identify the baseline. What were they able to handle? And you know that as a coach, as a parent, you're aware of what they were able to handle or not. Now, here's a kind of a mnemonic that I was repeating in my head. LMN, there's no O, and 2 Ps. Light, moderate, no contact, but they are at full exercise. practice, and then full play. Those are the 3 ways, those are the 5 ways, the stages to go through. LMN, no O, 2P. Now, managing the persistent symptoms, this is a little more critical. Post-concussion syndrome is something that can last up to weeks or months. Usually found in about 5 to 8% of those concussed patients. For athletes with post-concussion syndrome, again, refer them to a specialist in this area, not just your regular doc. Preventing concussion. Now, these are preseason assessments that they need to go through. Individual symptoms, cognitive evaluation, understand the mechanics of the brain and what they're thinking and going through. Balance. Balance is a big one too, and not just what they do when you're drunk driving. This is something that there's a lot more to it. Test for memory, concentration, and the host of other items here. Let's move through, follow the rules, very critical. Good sportsmanship is obviously a interesting point that I'll let Dr. Sock talk about later because he had some firsthand discussions with that. Good sportsmanship, correctly wear the right protective equipment, obviously appropriate techniques, and protective equipment and the host of things that go along with that. You need to know helmets were created simply to prevent fracture of the skull, not to prevent concussion. Not so much. Mouth guards are to protect your teeth as well, not for concussion, not to absorb concussion as you might think, unless you're hit from the chin. That's about it. And for those of us in Florida, if you have been determined to have sustained a concussion and are taken out of the game, you need to follow what the medical advisory committee suggests and find a practitioner trained in understanding concussion so they can release your child back into play officially. Dr. Sokolov, come on up.
So as we move on to our final chapter here, we want to give you some things that you can walk away with as coaches, as parents. What can you start doing now to help the children that you come in contact with? Number one, you're doing it right now. You are here because you care. We are here because we care about concussion. So number one is to keep learning. Do whatever it takes to take the next step to learn more about what you do. Be aware of the signs and symptoms. Real important. We'll be getting you more information on that. You can't learn enough about concussion. This is one of my favorite ones. Learn more about the kids you coach. If you're a coach and you're looking at a child that may have been concussed, I know you have kids on your team that you'll ask them, why did you line up or why did you do that during that play? And they don't know because that's just the nature of who they are. So you need to get to know your kids because some of your kids are loopy 24/7 without getting a shot to the head. So learn the kids that you coach so that you can better understand if, in fact, that person gets a concussion. Keep them hydrated. Real important, especially here in South Florida or wherever you are, whether you're inside or outside. The more hydrated your kids are, the more fluid, the more protection you're going to be able to provide that kid against concussion. And one of the things Dr. Barron talked about is if you do get a concussion, how important being hydrated is. And find experienced healthcare providers in your area that are used to dealing with concussion. Do it now. Don't wait, oh, well, now my son's concussed. Do it now. Why not now? This is an easy, proactive step. And you as coaches are going to get asked by the parents, well, who should I take it to? Should I take my kid to the pediatrician who maybe has never seen a concussion before but read about one? So, and baseline testing is another very interesting topic. There are a couple ways to go with baseline testing. There are certain computerized tests that you can get involved with, but there are certain balance and coordination tests that if you have a baseline of what they were before and then they get concussed, you can compare. Simple, easy, takes minutes to be done. A couple other action steps that you as coaches can take is teach your kids, the kids you coach, to communicate with you, that it's okay to say, hey, coach, I just don't feel right. Some kids fear their coaches, and we've got to eliminate that. They have to communicate better with you. And they need to communicate with each other, because sometimes they may not communicate with you. And they may talk to a friend, wow, I can barely stand up. And then that friend, I hate to use the term rat out, but is doing the best thing possible by helping their friend on their team to get them back and get them back healthy. Here's a big one. You need to teach the parents to communicate with you. As a coach, this is probably one of the hardest things that you're going to do, because the parent is going to look out for, my kid's fine. They're absolutely fine. But guess what? You as the coach are not going to allow that kid back into play, and you need the parents to communicate with you without having that written release that says, yes, that kid is okay to play. Parents can be tough. And you need to teach your athletes the rules and safe play techniques. Dr. Barron alluded to it earlier, sportsmanship. I can't tell you how many concussions I see as a practitioner of somebody that gets a late hit or a blindsided hit or something away from the play. I encourage parents to watch the games and watch the practices that your kids participate in. We are fortunate enough to stand on the sidelines in the NFL. We are fortunate enough to work with professional athletes. And you know what? Stuff gets missed at a high school level, at a college level, and there's hundreds of people watching. You as parents, you as coaches have to watch the games and have to watch the practices when you can. So if something does happen, you know the mechanism of the injury. A coach is not going to be able to see every single one of those kids on a soccer field. So you as parents have to help, and the way that you help is by learning. And a great place to start is the CDC. If you haven't gone through their program, it's a great foundation to start to learn about concussion. There are so many other avenues that you can pursue, but our goal here tonight is to help you open up your eyes to a concussion is not just a hit to the head. It can happen with a blow to the body. A perfect example, when I try to teach kids, I like to be visual, because I teach kids about concussion. I take an egg and I'll drop it on the floor. And before I do that, I'll ask them, what do you think's going to happen? It's going to break. So then I'll take the egg and I'll take bubble wrap and I'll wrap it all around to represent a helmet. And what do you think's going to happen when I drop it? Well, the egg won't break. That represents the helmet and your skull. And maybe that shell doesn't break. Well, that's a good thing. But don't you think that yolk on the inside got sloshed around? And the one thing that we tend to forget is we as parents, we as physicians, we as coaches talk about student athletes. And somewhere along the way, we forget that they're students first, especially as kids, and athletes second. So I want to thank you for taking the time tonight, and I encourage you to continue to learn, and when in doubt, you just got to hold them out.
Ladies and gentlemen, this is Kevin O'Neill, our head athletic trainer for the Miami Dolphins. He's been with them for 18 years. Before that, he was with the Dallas Cowboys during their Super Bowl run. This is the guy that he is the triage guy that brings in all the professionals to take care of your players. And he does an extraordinary job, and I love Kevin O'Neill. Come on up, Kevin.
The attention concussion is getting now is incredible. One of the things that I think is extremely important and valuable is that, concussions aren't new. They've been around forever. I've been doing this for a long, long time, and I think what is new is the right amount of attention that they're getting now. And I think that's the critical part about what this program's about and the message that it's trying to get out. It's really a great grassroots effort of trying to get to coaches and to parents and to give them some valuable tools to help them understand what is a concussion and what to do to try to make sure it's getting the proper assessment. we're learning so much, and things have changed so much over time. I'm very, very fortunate at the level that I work. We do neuropsychological testing on all of our players. We have a neuropsychological baseline test, so if a player has another concussion, we have something to go back to. We're very, very diligent about making sure they get back to baseline before we would even consider them to return to play. In addition, the NFL's added a whole nother layer of that, because now, once we feel they're cleared to play, we send them to an independent neurologist, which also ensures or warrants their health to be able to return to play. And that's a great step. I think that a lot of really, really good things came out of the most recent collective bargaining agreement as it relates to some of the things going forward in concussion. And there's so much new information coming out. It's, if you have a child that's car sick, if you have a child that gets migraine headaches, those children are probably more apt to have some of the extended concussion symptoms than children that don't get that. The same thing with my players. It applies across the board. Those are things that we didn't know a while ago. And so being able to understand that a little bit better, I think helps us to make better judgments in terms of how we manage players. But I think there's still a whole lot we don't know. And I think that, what it gives us is an opportunity to look at a myriad of different ways of treating them. And certainly, I am so appreciative to have Dr. Spencer Barron working with me, as I know the Ravens are with Dr. Sokoloff. And Jay, I don't have the firsthand knowledge of your work, but I know how Dr. Barron feels about you, and really that's good enough for me. He speaks very highly of you, and I think that we're looking at new things, new ways to help our players manage the symptoms after concussions. It's all very groundbreaking, very new things, and I think all of those things going forward help to be able to get a good message out to each of the parents and the coaches to let you know a little bit more about what it is you can do to successfully manage one if you have one, and the things that you can do to try to prevent not having one. The things that happen at this level with the NFL, the rule changes that happen here, the things that we're doing to prevent concussions with our players trickle down to every level of our sport. And I think is taken notice by all sports. And so I'm very pleased to have a chance to just spend a couple minutes with you. If there's questions that I could answer about concussion or something else that you want to ask, I'd be happy to field a couple of questions. I do better with that than I do with the science. That's why I have all these 3 doctors. Well, I think that as a parent, you should have good concern about having 3 episodes like that. I think that the brain, from what we know about it, has very good healing capabilities, as does the rest of your body. And so, short of having some major traumatic internal brain bleeding that might leave some scarring or some issue with function, I think most of the time what we know is that our players recover from these events. And there are some that have prolonged symptoms, and there are no cookbooks. There's no right way to do it for every person every time. You have to take each case. And so, as you can see, one time the symptoms can last longer, and sometimes they'll be shorter, and sometimes someone may not have many symptoms at all. What we know about helmets is this, and I've read the NOXI helmet warning to every football team that I've been around since about 1979. That's a long time. And that warning's changed a little bit in terms of its verbiage over time, but it tells us that no helmet can prevent all head injuries. And as we know, originally helmets were looked at to prevent fractures. And I think they've been improved and improved and improved, and they're still trying to improve them every day now to try to take away some of the side blows and some of the things that they were doing not quite as good a job at in their design earlier, and they've improved with those now. I'm not as familiar with how well some of the hockey helmets do that. But I know that, like anything else, if it's evolving in our sport, it will evolve in that sport as well. I think that if you have concerns over it as a mom, as you should, that it doesn't hurt to go back and have that doctor check him again and make sure that he feels that everything is right before you'd let him go back. And then I think you have to look at how he's getting hurt. What's causing the injury? Is it something he's doing repetitively? Is he ducking his head? Is he doing something technique-wise that can maybe he can adjust that can help him prevent that problem? Well, the NFL's funding a number of those studies, first of all, just so that you're aware. And we put a lot of weight into them. We try to educate our players. We try to put them in the best, highest-rated helmets that we know exist to try to eliminate, the possibilities as much as we can of them having a concussive episode. So the older helmets that were not rated as well, we've tried to weed out over time and put our players in the more highly rated helmets based on some of that information exactly coming out of those studies to help us inform our players and to help us make better decisions to give them better protection. Well, I think that the league's told us the best job on that, and that is they're not going to recommend one helmet over another. In fact, for 40 years probably, they've had a Riddell sticker on the helmet on Sundays on a lot of these helmets, and that's coming off because they don't want to feel that there's just one helmet. There's several companies out there that have very, very good products at this time that have put a lot of research and development into upgrading them. I think the number one thing that you can do in terms of your helmet is to make sure that your child or your athlete has the best fit. And if there's one that fits them best and affords them the best protection, then that's probably the one that's best for them.
What we are learning about soccer is we're spending so much time, especially I'm a little biased towards women's soccer, girls soccer, is that we're spending so much time in preventing ACL problems because that's what everybody talks about. But what I've actually instituted in my daughter's team is a neck strengthening program because it's not so much the brains, but the stuff that holds the brain. And you're exactly right. The repetitive nature of what they have to do, whether it's a smaller ball or a larger ball, can over time cause problems. So if we could make their neck stronger and they're better able to sustain the blow, then that's something that kids don't do. I remember high school football, we used to have to push here, push here. We used to do what we call isometric neck exercises. So what we've taught my daughter's team to do is with their soccer ball, every night, all they need is 2 or 3 minutes, and they go through a series of exercises against the wall with the ball in different ways, both isometric and with movement, with and without movement, to try and strengthen in all planes, as Dr. Barron said, that rotational, to get stronger that way so they can sustain a blow. The NFL has done a fabulous job with their Heads Up program in teaching technique in football and for football coaches. But what you just mentioned for the masses that are involved in soccer and basketball and other sports where there could be contact, teaching the rules, teaching the technique, and teaching the sportsmanship kind of puts it all together. Thank you.
They now have helmets that have sensors in them, and I think very soon on the NFL horizon that'll become more and more part of the landscape. But they also have mouthpieces that have sensors in them, and they now have a do-rag that has sensors in them. So some of these other sports are going to pick up on some of this and conduct some studies as well going forward, and they'll start to determine how some of the frontal and the side hits affect some of those forces because they'll get them measured a little bit better. I think that's forthcoming. Once one sport begins to do it, I'm sure others will copy that and go forward and find a good way to measure it for them as well. Thank you so much for being here tonight. Thank you for everyone's efforts on behalf of TIPS. Thank you.